So you just bought a massage gun.
What do I do with it?
Patients ask us all the time about what they should do with the massage gun. We'll use it in the office and they'll be like, oh, I have one of those. Can I use this? So this video is here to help you figure out what it is you should do, some tips and tricks.
Yeah, and stay tuned because we're going to cover which attachments to use on which parts, how to use it, how much pressure we're going to cover, like can you hurt yourself or hurt someone else. We're going to make sure that you feel as competent as possible and as close to us as possible when using it on yourself.
So some absolute no-nos, and some of these things you would think are obvious, but they're not always. If you have a really hot red area of your leg or your arm, if you just had a trauma and you're not sure if something is broken, if you have an open wound, do not use this, right? So you first want to make sure that kind of all of these red flags are not red flags. If you're unsure if it's a red flag, you should probably ask someone.
Yeah, step one is if you're not really sure, go to someone like us, Mobility Doc. Feel free to comment or reach out. If we have to, we'll let you know if we need more from you to answer you. But if you're not sure, ask for help. Other than that, it becomes a little bit more obvious. Like, don't put this in your eye. Don't use the gun into your throat.
Less obvious ones, though, are don't go over bone.
Yeah. So like what Chloe means, do you want to show them just?
Yeah, like so you wouldn't necessarily go like over the tip of the elbow. Sometimes people are inclined to go down the center of the spine, that bony part. Don't do that.
Yeah, except we will get into one of these pieces you can do that with, and some of these pieces you shouldn't do that with. So you can go over the spine, but it's more like you're going around it with the appropriate
but you're going
attachment.
on the muscle that's around the spine. So
yeah, technically
still not on bone.
Yeah, technically I'm still wrong.
Technically we're just on muscle.
Why don't we tackle first the appropriate amount of pressure, since you can show that. First we'll do it with it off, then we'll do it with it on, just so that way you can maybe see more clearly.
Yeah, so step one is that you just want to make contact with the skin, okay? So the thing is that you don't have to start with first pressing. So this isn't like foam rolling plus the massage gun. You can just start with going on the skin.
Yeah, start superficial. Don't add pressure yet. So let's turn this puppy on. All right.
So this hypervolt has 5 speeds. You know, start conservatively. You don't necessarily have to just start blasting it up at 5.
No, but if you're on and if it's not a very painful area to begin with, if it's just like recovery after sport, you can probably put it somewhere in the middle. But if you have had like a nagging hamstring or calf issue, something a little more superficial, like epicondylitis, like golfer's elbow, tennis elbow, maybe start on the lowest setting with the least amount of pressure just to see how it feels. But if it's just recovery, you can probably be a little bit more presumptuous with how you start. Mm-hmm.
Unless you're super sore, then you'll definitely really
you'll
feel
know.
it. Yeah, you'll know. Yeah. Okay, so we're gonna start out at 3 for John, and I intentionally started out at 3. This is not recovery for him. So what I'm doing is I'm running down the length of that muscle. So these muscles that are on this like top part of the forearm, I'm just going down the length of them. Now, it is true, you can kind of see where this bone is, so I'm not spending a ton of time down here because this is also mostly tendon. I really want to be focusing on a little bit more of that muscle belly.
The meat. Get to the meat.
Get to the meat, yes. And then you can kind of start to approach a little bit of where that bone is, but again, I'm still staying off of that. I really want to be focusing on a little bit more of that muscle belly. And now you see too, like I'm not moving too quickly because what we're doing is we're just trying to scan through that area. So we're just kind of seeing, okay, what is this whole area like? And even if you find a spot that feels pretty tight, just still for the first minute, go through that entire muscle because you're just scanning that entire area. It's going to be helpful to not just focus on that area that's tight, but focusing on the entire muscle will help to increase blood flow and will help with even that area that is painful.
So why don't we address which head we're using, since we're getting into, like, you search for an area that's tender or sensitive, you stake to the muscle belly, If you know, in the case of, since we'll start with forearm, and let's say I have tennis elbow, which is pain on the outside of my elbow, you don't want to go right into the pain point. You want to cover the muscle around that because of all of this being important. So which head would you recommend?
So if you have one of the hypervolts, my absolute favorite one is actually this like rubber one. It's like the plunger, is that what you call it?
Yeah, like the soft tipped head.
Because it's a little bit more diffuse, some of that pressure, so it's not so pinpoint, which is great for that scanning.
Yeah, and even if you don't have a hypervolt, pretty much every brand has the exact same one. So you want to start with, and maybe in general, it's like a good practice to start with the softer one before you commit to like a harder one, like Chloe's gonna show you.
This one too, this ball-shaped one, a lot of times people have, and sometimes they don't have this softer plunger one, but you see the difference between the two heads. Now, this one is going to have a little bit more focal pressure, as opposed to this one is going to be a little bit more diffuse. So you might actually feel this one a little bit more, and it's also harder too. So all the more reason, don't start with putting pressure on that area. But if you have this one, you might want to start with like level 1 or 2 as opposed to 3 or 4.
Yeah, exactly. But pretty much every single gun that we've ever seen, every single massage gun has a soft head and has at least one hard one and one pointy one.
Yeah.
Like that little bullet, which we'll show you how to actually use that or what it would be good for. All right, so we started with the soft tip one. Now I'm a little scared. Yeah, are you showing, should we go over which one not to use?
Yeah, no.
Okay.
No. So we just scanned through this area for a minute. So, you know, that blood is already flowing. It's relaxed a little bit. Then you can kind of stay in that one area that feels a little bit more uncomfortable. Then once you, maybe after about 30 seconds to a minute, then you can, but you don't really have to, but you can go to this pointed one where you're going to get a little bit more of a focused effect.
Yeah, kind of a lot more, because you could see it's the surface area that you're treating yourself with is like no more than maybe a thumb in width. So Chloe's starting with a lot less pressure again, which is nice because I wasn't sure how that was going to go.
Yeah, and I'm still staying off of this one part, like kind of right by the bone. You know, people will describe it as like they have this point tenderness. I'm not going right over that area, but I'm just going just around it. And the other thing too is that you notice now I'm only doing this like little inch area, just going back and forth. Because again, we're being more specific with the point, and then we're also going to be more specific in terms of our movement.
Yeah, so we identified first with the head that we were using before, and now Chloe has a good idea of where to go back to. And if I was doing this myself, I would have a very good idea because I feel it, right? So now she is spending more time on those specific areas that we've identified as like, oh, there's something here that shouldn't hurt. And if you spend enough time and enough days working with the massage gun on yourself, you will see that your starting point of sensitivity and pain will come down, and it'll feel less painful as you go. If it's starting to hurt more, that's another one of those, like you're either not supposed to be doing it or you're going too hard. So it should not hurt.
Or for too long.
Or for too long, yeah. So you could be either pushing too hard, using the wrong head, going for too long, or it's just not ready yet. So it should never hurt more when you're done.
The other thing that I'll say to patients a lot of times is to use a lot of that same protocol that we would use for foam rolling. So, you know, you scan through an area for 1 to 2 minutes, then you can start to focus on one area a little bit more. That's what we're doing. So we use the that broader head, the one that provides diffused pressure to scan through a muscle group for 1 to 2 minutes. You can do a little bit longer, but what, more than how long would you say?
3 minutes is not necessary.
You're not increasing the efficacy. Yeah. And then from there, then I would go to something a little bit smaller, because then that's when we talk about for foam rolling, where you're going to hold an area and then, you know, bend and straighten that knee, then you're kind of getting a little bit of that same effect.
Yeah.
So this head I really like because it's really good for going just along where the bone is. So along John's, along his forearm. So here, right where you see, like, here's the elbow, I'm coming up through here, okay? So like this is his ulna. Now, if I feel here, here's his bone, but then just off of that is where the muscle belly is. There's tons of connective tissue that connects like a group of muscles to the bone. So that area can get pretty tight. So this guy is really helpful then for just kind of working through that.
Yeah, and this is where you have to be really careful to not just slam off of your ulna, like what Chloe did right there.
I just did that a little bit.
You'll know, like, if you hit the bone.
Do this to yourself, you know.
Yeah. If you hit the bone, it'll bounce and ricochet. If you're in the muscle, you won't get any kickback in through your hand. And then as you get to the elbow, just be a little careful. Because
be careful because your ulnar nerve is right there.
Yeah. So you might get a little bit of tingling in your finger. I'm getting a little bit of that. If you go too close to your elbow, to the tip of the elbow down here, you'll actually hit the nerve.
Yeah.
And that's not helpful.
Right. Yeah. So then, like, if say like you go through like where your bicep and tricep meet, I wouldn't actually recommend going like right above there, because that's like right where the ulnar nerve comes through. So you don't want to do that. Just don't mess around with the nerve. If you start feeling numbness and tingling, then that means back off.
While we're on it though, like this attachment's really good for hands, right? Mm-hmm. So you can really frame out like fingers with this. With like the other attachments, they're just too big. And too wide.
You need this.
Yeah. Anytime Chloe says you need this, it's true, but you don't want it. All body parts are the same. You're going to scan first and search, and then you're going to spend a couple minutes or so back on specific areas that need it. We work with our hands a lot. You might also, we highly recommend using this on your hands for any of you that just feel a little bit beat up after years or the end of the day. But to that point, right, if I pull out one of these, if we used this like big one, like we're just covering my whole hand at once, basically. So like you can get more like nuance with the tip, and you could always start with this, but you would not use this. Why would you use this? It's coming, hang in there. This one's also good with shins. My turn. A lot of us experience shin splints at some point, some on the outside of this bone, your tibia, sometimes on the inside. Your tibia is kind of the same that we're talking about with the ulna, in that there's a lot of connective tissue attaching here. So what you can do is you can use this pointy part. I've already used the soft tip, right? And I've worked my way and we found things.
He is not, actually.
Yeah, even if...
Okay, let's see, guys.
No, I'm going to be gentle.
Okay, you're starting at 3. I was at
it's
1
on
with
2.
you. Okay.
But pro tip, right? Keep your fingers on the bone, whether you're, like, especially if you're doing it to a friend, right? Because it's easier then. You can keep your fingers on the bony part, and then what I'll do is I'll frame just off the bony part.
I'm so ticklish. God.
This is good. So it's not pain though.
No.
Okay, what about that?
Okay.
That's pain. So if you push too hard,
I'm gonna do that to you.
I don't need this. So same rules apply, right? But I wanted to demonstrate this just like on your forearm. It's really great for getting close to the bone without hitting the bone. If someone's really ticklish, like even your...
It's like, I don't feel it at all when I do it to myself, but then if someone else does it, like whenever, I always say that to my patients.
If you hang in there, you'll eventually desensitize the area.
Yes.
But you might need to start on a lower setting if they're ticklish. If you do this to your kids, that's a big thing we hear. Kids that say, we have a lot of swimmers, right? And parents using it on their children's shoulders and on their backs.
Oh, yeah.
And kids are always very ticklish. They almost feel ticklish more than they feel pain, even though you might feel pain. So our recommendation is actually, like, you could layer up more. You don't have to be right on the skin because it's not that important to be right on the skin. And then you use it on a low setting with like minimal pressure. If I use less pressure, not very ticklish. If I use more pressure, it becomes more ticklish. So back off the pressure. All right.
I'm really trying to not laugh even.
Yeah, we didn't practice that, so I didn't know this was gonna happen. Yeah. All right, so we've got more heads. Let's figure out why you use this, okay?
Oh yeah, like this would be game over for me. I'd be way too ticklish.
Yep, all
right. This will be good for John to work on his spine. So I'm using this one. So here's the thing, guys, is that I said don't go over the bone. So what I can feel here right in the center of John's back, this is where his spine is, okay? So the two heads, these little two heads, they're going on either side of the spine. That will follow the paraspinal muscles. So these are the muscles that are on either side of the spine. These get quite tight. You're also going to get the added benefit though of gently mobilizing the joint because you have these transverse processes. They're kind of the edges of each of the vertebrae. So these are going to apply a little bit of pressure to each of those transverse processes. Okay. All right. So here we are. So it's even more important with this one, I would say. I like to actually already make contact with the skin before I turn it on, and I'll start pretty low too. So I'm starting just kind of right in John's middle back because that's also where it tends to be the most stiff for people. So find bottom of the rib cage, and you're going to go to the bottom of the neck. Okay, so I'm just going to, again, no pressure. I'm just going to turn this up to 1. Okay, so you see how it was like already kind of like jumping off of John's back a little bit. So I'm just holding here just on either side, and then all the more reason too, like I like to actually put my finger just kind of on that spine so that I'm not going along that. So as you're going along the spine, a lot of times what I like to do first, same idea of like I'm doing this scanning motion of I'm coming up just like this. You'll find also some areas in terms of like if they're starting to if it's like starting to be a little bit more like painful, then you can just kind of move off of that. The other thing is that I'm trying to stay perpendicular to his torso. Coughing is totally normal for someone because you're actually mobilizing a little bit of the ribs. You can have like a cough reflex. I'm going to work my way up John's spine as I'm doing this. So I'm not moving too quickly, especially because I'm really trying to make sure that I don't hit his spine, but I'm going to go the whole way up to just to the base of his neck, and then you can go all the way down to that lower back. Especially though, if you focus on that middle back area from the bottom of the rib cage to the base of the neck, there you're going to get that added benefit of mobilizing the joints of the thoracic spine, which are like that middle back, that middle spine, which tends to be the most stiff. Now, what I can do if I want to just get a little bit more of a broad effect, then I'm going to use this ball, like this little sphere, to work through not only just the paraspinals, but also the lats too. So again, same thing that we have been doing, where I'm going to kind of trace along the spine, and then I'm coming up and down. Now, again, like I can move with a little bit more speed, but you also don't need it to be too fast either. And then I'm coming to just on the side of where the ribs are. I'm coming the whole way. This seems like this is probably pretty tight for him, but you see, like now, again, I'm still trying to keep this. Oh yeah, he's tight there. Just trying to keep him perpendicular to his body, and you'll be able to feel too when you kind of move off of muscle and you get onto rib. It's going to kind of do this like bouncing kind of sensation, which it just did for John. Oof. Be careful when you're using this one and you're coming up around that shoulder blade area and you're on your stomach. Some of the bone of the scapula might be kind of like pushing out a little bit, so you have to be careful then too with that one, that you know that you're not just going to ricochet off of the bone.
How to use your massage gun for the calf into the Achilles, because that's another big one that a lot of people ask us about. You know, can I hurt myself was one of the things that we led with, and the answer is not always no. Of course you can hurt yourself, but you'd have to really ignore the signs we said at the beginning. Plus, with the Achilles, what you can do is you can really aggravate it. If you go too much right on the Achilles tendon, you're just going to make it angry. But what I would suggest is starting with light pressure. What I saw that didn't make any sense on social media recently was people using this. I've been wanting to talk about this. They've been using the one that Dr. Chloe used on my spine, which felt awesome, and they've been using it on their calf Achilles, and it doesn't make any sense because I'll just have it on in light. Like, you can arguably you can frame the connective tissue of the Achilles and around
You'd
the
have
calf.
to have a pretty thick Achilles though, to do that.
Yeah, so you're kind of just wasting your time. So don't use this for that. Instead, start with maybe the ball. I'm using the harder tipped one. You can experiment with the softer one first if you're not sure, but I'm just going for it here. So we're gonna start up at the calf. You have the two heads of the calf here on the outside and the inside. And again, we're searching, we're using light pressure. If you're doing it to someone else, you're gonna have to pay attention to their face a little bit to give an indication.
He's going nice and light, which is helpful, because I definitely need this.
Yeah, well, at some point we do leave here, so
yeah.
I'm trying to be nice. What we haven't gotten into yet that I think would be good is let's talk about movement with it. If you want a little bit more benefit from your time spent, what you can do is, and Dr. Chloe's already doing it because she just knows, you can move a joint to get the muscle to stretch and shorten. So for the calf, it's all about pointing the toes and bringing them towards you, or plantar flexion and dorsiflexion. So you yourself or the person you're doing it to moves back and forth their foot, you can continue to work through the calf. Or again, you can do this on a quad. If I came up here, let's do hamstring. Sorry, I forgot it's ticklish. So Chloe's gonna bend and extend from her knee. Again, I would probably still use this larger head because the hamstring has got more area than like your forearm or your hand. When you're adding movement, maybe 10 to 15 repetitions before you would maybe move to a different part. It could be less, depends how much they need it. And I can also move while she's moving. You can move while you're moving yourself. Good, thank you, you can relax. What we have here is the Hyperice heated head, and it does exactly as advertised. It gets hot, and it gets hot fast, and so the heated head is not included with the purchase of a hypervolt, but it is a great additional purchase that you can do and use on any of the guns that they have. The thing to keep in mind is this is a hard, flat head, right? So again, you wouldn't want to do this on a very bony area. Also, it'd be kind of hard to do this on a very small area, like maybe the inside of the elbow again. But it's perfect for a calf, and it's perfect for a hamstring and a glute, and other areas that it just fits on perfectly. So, turn it back on. Now, because it's flat and because it's harder, you can also get more pressure into it. So keep that in mind, that you're gonna have to start over again with how much pressure you're applying to yourself or to someone else to make sure you're not doing too much. But everything else about it, it's the same. And the reason why heat is so great is because heat encourages blood flow and circulation. That's also just true about the vibration itself. Promotes blood flow and circulation. It helps your brain send a signal back to an area to get the muscle to relax. It helps promote healing. And the more vibration with a higher setting you get can be more beneficial. And with the right amount of pressure with that vibration, you can get that much more out of it. So if you have a gun that is too weak and it's stalling on you, I recommend get a bigger purchase, get the next one in the line, or just get a different brand, which is why we stick with Hyperice, because it just works well, because you need that pressure with that vibration, and the heat adds to the vibration to get even that much more blood flow and circulation. We hope you found this video helpful.
We know that we gave you a survey of a lot of these muscles with using the different heads. So if you want us to do a deep dive, just include it in the comments.
And also, if you have suggestions on body parts or areas you want us to cover, it doesn't have to be with a hypervolt. It can be about anything that has to do with sports medicine, PT. Feel free to just ask the question and we'll let you know. Thanks for watching.